The countdown is on for people to decide on their Medicare plans for the next year.
Today's CI Health sponsor, Health Alliance. We have Tara Mullins, the manager of business intelligence and strategic growth, here with us now to talk about, it's hard. This time of year is here now. It is here. We got to start thinking about Medicare and enrolling if we're not.
Absolutely.
So what should people know?
All right, it's the Medicare annual enrollment period. So it started last week and it runs through December 7th. And that is the time that people can take a chance to look at what they have for coverage and see if they need to assess for something different for next year based on what their current health plan or health needs are.
We are going to ask a lot of basic questions because we don't understand this very well.
That's why I'm here.
I've seen Medicare Advantage. How is that different from regular Medicare? Is it?
It is. It is very different. So Medicare Advantage takes Part A, which is your hospital, Part B, which is your outpatient, and it can include Part D, which is your drug coverage, and puts it all into one. And so that's a nice, complete package that is similar to what people are used to when they're on an employer plan, where it's all in one versus being pieced out. And it offers more than original Medicare and Medicare Supplement because it has some additional perks and things to it that can be included.
Oh, yeah.
You were asking the right person.
Yeah, we're going to get to those perks. But first, why should people choose the Medicare Advantage plan from Health Alliance?
Yeah, you know, we're a local health plan, so we're owned and operated here in Champaign, Illinois. So we've been here a long time. We're provider owned and provider affiliated. So the health plans that are available here with people are designed by the physicians and the providers in the local community.
Oh, wow.
Now, this is the time of year. Like, if you're going to do this, we have till the 7th, and then if you don't, you're out?
Yeah, there are special election periods or other periods that people may qualify for, but this is the big time of the year, and we see, you know, that's the majority of the time where people are making their decisions, and it needs to be by December 7th. That means application in hand, not in the mail by December 7th, so it can be...
So this isn't like your taxes. You can get it in at the midnight on the 15th.
The mail date does,
Yeah. Okay, let's talk about some of those perks, because I know we've talked before in the past about the dental and the vision and hearing, but something new it looks like is some acupuncture coverage.
Yes.
Wow.
And this is a serious conversation really about how this benefit came to be. And nationally, the opioid epidemic has been a big concern. And so we've been trying to figure out what way as a health plan can we help people not be dependent on an opioid for pain. So the acupuncture benefit came to be an attempt to try to help with some pain management.
Wow.
Interesting. I would not have had any thought that that would have made it into the mix, but that makes lots of sense once you explain it.
You've also got fitness programs.
Fitness, dental, some hearing.
Travel? I thought we've talked about that before.
Yeah, we've talked about our Assist America program. So if you're more than 100 miles from your home or out of the country and you need some assistance, maybe an interpreter if you're out of the country or something like that related to your health care. Yep.
Very nice. Tell me what Simplete is. S-I-M-P-L-E-T-E.
Yeah, that's new this year. So Simple and Complete is Simplete. It's a new approach to healthcare with the providers in our local community to offer those health plans. And it's really about that collaboration and integrates more with care coordination and health coaching and really just being that full continuum of care for the patient end to end.
And this is a lot of information for people to take in, and they may still have questions. What's the best way for them to reach out and learn more?
Yeah, absolutely. They can come and talk with us out at Carl at the Fields, 3301 Field South Drive, 3310 Field South Drive. It's right across from the administrative building out there. Also visit us at healthalliance.org. You can also reach us by the phone number that's on the screen. You can come visit us, and you can have a walk-in and visit us, or you can have an appointment, or whatever works best for you.
Did I see you also have virtual appointments, or is that for something else?
Yeah, virtual visits they're included in our plan. So if a person doesn't want to get out and about and they want to call in from their phone and do a video call, those are $0 on some of the plans. So
it's harder to get shots that way.
It is a little bit.
That's true.
I don't mind. Hey, thank you, Tara, for being here. We appreciate it. She knows everything, and we will connect you with her and with Health Alliance and all the details that you need for getting your healthcare and Medicare set up before December the 7th at CILiving.tv.
Coming up, it's one of the most fun runs you can participate in. We're talking about the Cupcake 5K with the Champaign Park District.